everybody. I am Dr.Radhika Meka, gynecologist and IVF specialist from Parampara Fertility and Gynaec Center, Kilpok, Chennai. Today we'll be discussing frequently asked questions by the patients during the corona times. Yes, we have opened up our fertility clinics and looking forward to start our treatments. So, with all the precautions from our side and your side, it is safe for us to go ahead with fertility treatments. To prevent the spread of coronavirus, you should always be wearing a mask, maintaining the social distancing and follow the hand hygiene. You should be washing your hands at least for 20 seconds. And apart from that, avoid crowded places and avoid travel. So with all these precautions, we can go ahead with the fertility treatments. We are also from our side spacing our appointments so that we don't have a crowded waiting area. So we advise you to stick to the appointment timing and come. We would also advise you to inform us if you have any fever, cold, cough or sore throat. Before we start treatment, we usually check the COVID testing and then start treatment. So if it is a frozen embryo transfer, that is, we've already collected your eggs, made embryos and frozen them, then unfortunately we might need to cancel the cycle. If you're going for an egg collection and started injections just a few days back, then probably we would be cancelling the cycle because you might develop fever, which is quite detrimental for the egg quality. But if you are towards the end of the stimulation, then we might give you an option to go ahead, keeping in view the money and the time spent for the treatment. We would take all the precautions for COVID-19 during the egg collection procedure. And once we finish the procedure, we would isolate you and start the COVID-19 treatment. Still, it is a new virus. So lots of studies are going around, so hopefully we would know in the near future. So pregnant women do not appear to be at an increased risk compared to a non-pregnant population. But what we have to understand is pregnancy is an immunocompromised state. So these patients, these ladies are in the vulnerable and high risk group. So they have to take extra precautions and extra care in the COVID-19 times. We have reports that COVID-19 pneumonia has been mild and the recovery rate is very good. In the first trimester, we have seen a slight increase in miscarriages, abruptions and early deliveries. But all these are very few cases. We cannot come to any confirmatory conclusions regarding that. As of now, what we know is the virus is not teratogenic, which means that it doesn't cause any big malformations, congenital malformations to the baby. So it is not an indication for termination of pregnancy. So the women need not terminate the pregnancy if they are infected with coronavirus. So vertical transmission is transmission of coronavirus from the mother if she is infected to the baby. So this is possible but still not confirmed. There is no contraindication for breastfeeding. You can continue breastfeeding, but you have to take the safety precautions like wearing a mask and maintaining hand hygiene, washing before and after feeding. But if you're still worried, you can express milk and ask the attendant to feed. You have to isolate yourself from the baby for about 14 days.